name is Hattie Toussaint, and the topic I chose for my presentation is informed consent. Informed consent is an active shared decision-making process between the physician and the patient. It's an agreement to allow something such as surgery to happen based on a full disclosure of risks, benefits, alternative, and consequences of refusal. Under the doctrine of informed consent, physician or advanced practice nurse must disclose information so patient can make intelligent decisions. It was mandated by federal statutes in the case of Medicare and Medicaid patients, and state laws and grounded as well as common law. Information about the procedure or treatment must be disclosed by the provider and cannot be delegated to the RN. There are 3 conditions that must be met for consent to be valid. First, must disclose adequate diagnosis, nature and purpose of treatment, risks and consequences, probability of a successful outcome, availability, benefits, and risk of alternative treatment, and prognosis if treatment is not instituted. The second, the patient must demonstrate clear understanding of the information prior to preoperative sedative drugs. If sedation takes place prior to signing the consent, surgery may be canceled or delayed. And the third one is patient must give consent voluntarily. If the patient signs a consent form already, the patient can revoke the consent at any time. Nurses, they do not legally assume the duty of obtaining the consent form. They assume the responsibilities of witnessing a patient signing the consent form. They should not carry out any interventions or treatment without a consent form. If the nurses believe that no consent form for the procedure was given to a patient, the provider should be notified immediately. The nurses should always document patient questions or concern in medical records to indicate delayed in carrying out the procedure. Parents are legal guardians of pediatric patients, so they sign a consent form for treatment. If the parent are divorced, the parent with legal custody gives the consent. If the parent refuses medically necessary treatment for a child, the healthcare provider petitions the court to intervene on the child's behalf. They use the standard known as the best interest of the child. The courts may override the parent's decisions. Children, often adolescents under age 16, may characterize as emancipation or emancipated. Characterization refers to their legal standing as competent adults. Even though emancipated minors have not achieved legal age of consent, they may give consent to the procedures or treatment. Emancipation is a certified legal document. If the patient is unconscious, consent must be obtained from a legal authorized person to give consent on his or her behalf. If there's an emergency situation, the healthcare providers may provide care to patients without consent. Presume that a reasonable person would have agreed to similar or the same treatment. Legally incompetent patients need consent of a legal guardian, which is determined through a legal proceeding. How my topic linked to BSN Essentials, I picked Essential 8. As the goal of informed consent is to assure patient autonomy. The nurse respects the patient's right to make decisions about their health care. How QSINs link to my topic through patient-centered care. Nurses become the patient advocate by ensuring that they receive and understand information needed prior to signing a consent form. Nurses ensure that patients are engaged in their medical decision making. And that's it. Thank you.